If you're planning to continue working past 65, there are 6 critical mistakes you need to know about to avoid permanent penalties on Medicare. If you don't sign up properly, you could end up paying hundreds, if not thousands of dollars more than you need to. That's why in this video, I'll go over these 6 critical mistakes and what you can do to avoid them. And at the end, I'll also throw in a bonus checklist of things that you need to do in the months before you retire. I'm Calvin from PlanFit, and I've been helping seniors avoid Medicare penalties for over 14 years now. And today, I'm going to help you set up things properly if you're thinking about working past 65. But before we get to that, let me first go over the basics of Medicare penalties. I'm sure you already know there are 2 parts to Original Medicare. There's Part A, which covers hospital bills, and Part B, which covers your medical costs. Together, these 2 are called Original Medicare. For Original Medicare, the vast majority of people won't have to pay premiums for Part A, but almost everyone has to pay a premium for Part B. And for most people, it's $174.70 in 2024. Now, here's where things get tricky. There is a 7-month initial enrollment period for Medicare. It starts 3 months before the month you turn 65, and it ends 3 months after the month you turn 65. If you enroll during this period, everything will be fine. But listen carefully. If you miss the initial enrollment period, you could get permanent penalties on your premiums. For Part B, you'll get an extra 10% tacked onto your premium for every year you delay enrollment, and that penalty never goes away. So let's say you enroll for Part B 2 years late. That means you will have to pay an extra 20% on your Part B premium for as long as you have Medicare, which is essentially the rest of your life. So instead of $174.70 a month, you'll be paying somewhere around $210 a month. It doesn't sound like much, but this adds up to an extra $420 a year. And it's something that was completely unnecessary. If only you signed up on time. If you had signed up on time, you wouldn't have to pay this. That's why if you're retiring, you need to enroll during the initial enrollment period. But okay, what if you're planning to work past 65? What if you have a great group insurance from your employer? Do you still need to enroll in Medicare during the initial enrollment period to avoid penalties? Well, the short answer is no, you probably don't have to, but it's a lot more complicated than just that. There are 6 mistakes that you need to be aware of, so let me break them down for you. The first mistake is thinking that you don't need Medicare because of your retirement insurance. Most of these plans are fine before you turn 65 because they cover your healthcare costs first and you pay the remaining balance. But once you turn 65, things begin to switch around. Medicare should be the first payer and these plans become the second payer. So if you have one of these plans, then you really need to look at Medicare when you're turning 65. The second mistake is not counting how many employees your company has. That's right, you actually have to count how many employees are on your group plan, or someone should count and tell you, or your HR department should tell you. Now, I should take a break here for a second and explain that I keep talking about you working, but it could be that your spouse is working and you have a group plan through your spouse. But in these situations, you need to ask the HR department how many employees are in the company. So look at the visual here. If your company has less than 20 employees, then Medicare will be the primary payer, and you are required to enroll in Medicare. If your company has more than 20 employees, then the group plan will be the primary payer, and you don't necessarily have to enroll in Medicare. You have to decide if it is the right thing to do or not. In many cases, having Medicare and your group plan is also not a good idea. Typically, it's going to be one or the other. Typically, it will be have Medicare or have your group plan, but not both. Okay, now let's talk about the third mistake. When you're getting ready to retire, it's very important not to assume anything. Don't assume that your group plan is better than Medicare. And don't assume that Medicare is better than your group plan. One of the most common mistakes I see seniors make is to not compare and calculate these plans. That's why I highly recommend going over the details of your group plan and Medicare to see which one costs less and which one provides better coverage. Comparing the premiums, deductibles, co-pays, and coinsurance, you have to compare all of that. You want to have a definitive answer on which plan is better for you. But generally speaking, There are 3 reasons why most people choose to stick with their group plan. We find that it's sort of a mixed bag. Sometimes it's better to go to Medicare, sometimes it's better to stay with your group plan. In 2025, it's going to be especially critical that you review your group coverage versus Medicare, because in 2024 and previously, almost all group plans were equal to Medicare. But with the new rule around prescription drug plans now being capped at $2,000 for Medicare plans, so in the future, more people will need to join Medicare, or they may be penalized for staying with their group plan. It's going to be very interesting. But in 2024, there are 3 reasons why quite a few people stay with their group plan. I'm going to tell you what those are. Number 1, because their spouse is covered under the group. So if you have a younger spouse that doesn't have their own health insurance and that isn't old enough to take Medicare yet, then you might consider delaying your Medicare, because Medicare only covers you and your spouse will lose their coverage if you no longer have your group plan. Number 2 is that maybe you still have young children. Group plans will cover your children now up to 26 years old because of the Affordable Care Act. And if you decide to switch to Medicare, maybe your children will lose their coverage. So that's a family consideration. And finally, the 3rd reason why some people stay with group plan is that maybe it's better than Medicare in covering their prescriptions or their costs, and the premiums perhaps are paid by your employer. Remember that Medicare isn't going to cover all of your healthcare expenses. So if your employer is paying for your insurance and it covers you very well, that could be a reason why you stay with it. Having said all of that, I really encourage you to look at the details of your plan and your situation when you decide if you're going to stay with your group plan if you're working past 65 or go with Medicare, because you really have to decide which route is best for you. And in some cases, there's a clear answer. So that's why I encourage you to really look at the details of your plan and your situation when you're working past 65, because you have to decide which one works better for you. And sometimes there's a very clear answer. And if you make a mistake here, sometimes you could be penalized by Medicare. So that's a clear answer. So make sure that you really have done your homework and your due diligence, and we can help you to do that, to be sure that you're choosing the right plan for your situation. Okay, let's move on to the 4th mistake now. I know I've said that there are many cases where you want to stay with your group plan, and I imagine this is what you're thinking. Hey, if I choose my company's group plan and delay enrolling in Part B, won't I get a penalty for not taking Part B when I sign up? And the answer to that is no, not if you do it right. But before I elaborate on that, let me just say that if you're learning something new here, please hit the like button. Our mission at PlanFit is to help as many seniors as possible, and by liking the video, you'll help this video reach someone who needs to know about the penalties that they can get if they choose to keep on working past 65. And if you're looking for more Medicare Simplified videos, hit subscribe, because we're publishing videos like this all the time. All right, let's get back to the penalty. Okay, so if you're uninsured, or if you have these insurance plans here, or if your company has less than 20 employees, you will get penalties if you miss Medicare's initial enrollment period. However, if you are covered by you or your spouse's company insurance plan, and your company has more than 20 employees and it meets the minimum standard for Medicare, then you don't need to enroll, and you'll get a special enrollment period for Medicare when your plan ends. Now, the special enrollment period runs for 8 months, starting when you or your spouse stop working for the company or your insurance coverage ends. That means that you could yourself elect to end your coverage and enroll in Medicare. So there's a lot of flexibility there. In this 8-month period, you can enroll for Medicare Part B without worrying about the late enrollment penalty, even if you're years past 65. You will, however, have to submit some additional forms when enrolling to prove that you had good insurance coverage from the time that you turned 65 until the moment that you signed up. The first is the CMS L564 form, which the HR department of your company will have to fill out to show that you were covered by their insurance plan. Now, keep in mind that most employers aren't going to send this form to you automatically. You're going to have to ask for it and get it filled out. If you can't get an L564 form from your HR department, you can also use the 1095B forms that you get every year to show that you were covered. So make sure you keep those. Those are the forms that you get from your employer every year that say that you were covered for the year, that you use on your tax return. You need to keep those for every year that you should have been on Medicare to prove that you were covered and to avoid penalties when enrolling. Then, in addition to that, you'll also need to fill out the CMS 40B, which basically tells Medicare when you want your coverage to take effect. In many cases, you can sign up for Medicare and submit these forms online, but in some cases, it doesn't work. So you may need to go to your local Social Security office or mail the documents in or call Social Security to get guidance. When possible, it is better to hand deliver. It works a lot faster, but you can also mail them. All right, so that was the first 4 mistakes, and they were all about original Medicare. However, the next 2 penalties that you need to be aware of are about the insurance that goes with original Medicare. So the first is about prescription drug coverage, which is called Part D. You need to get prescription drug coverage or Part D coverage as soon as your Medicare starts. Medicare prescription drug plans have the same 7-month initial enrollment period as original Medicare. And if you miss this period, you're going to get a permanent penalty on your drug plans as well. For Part D, the penalty is an additional 1% for every month that you delay. So that's 12% a year. Now, it's not 12% above your premium. It's 12% times by the national average for prescription drug plans. So when you sign up for prescription drug coverage, you might have a really low prescription drug premium, but your 1% is not multiplied by your prescription drug premium. It's multiplied by the national average prescription drug premium. So if your premium was very low, but the average is in the middle, it's still 1% off the average for every month. 12 months, 12%. 24 months, 24%. 5 years, 60%. So we have met people who have to pay double what the average premium is for their prescription drug plan because they didn't take it when they were first eligible. Now, if you have delayed your prescription drug plan because you have other coverage from your employer, your spouse's employer, or some other retirement plan that is, now, listen, this is really important. It has to be equal to Medicare. It can't be worse than Medicare. But if it's equal to Medicare, then it counts as creditable coverage. Creditable, meaning that it credits towards Medicare and you don't have to take Medicare. So your insurance is equal or better to Medicare Part D. It doesn't matter where the drug coverage comes from. It can be from your employer. It could be from a separate drug plan. As long as it's equal or better to Medicare Part D's coverage, then you don't have to worry about penalties. Now, this is a real challenge coming in 2025 because Medicare prescription drug coverage is improving significantly. So a lot of plans that in 2024 and previous were considered creditable coverage, they will not be creditable coverage in 2025. So if you lose your drug coverage, you have a 63-day window to enroll in a Part D plan. And once you do that, you will not have a penalty. However, if you don't have creditable coverage for more than 63 days, then Part D penalties will start stacking up. Remember, the penalty is an additional 1% per month. So the sooner you enroll in Part D, the lower your penalty will be. These penalties are lifetime penalties. That means that once you've accrued a penalty, you'll keep paying that for the rest of your life. We've made it to the 6th and final mistake I want to talk about, which is missing your open enrollment period for a Medicare supplement plan, which are also called a Medigap plan. In case you don't know, Medicare doesn't cover 100% of your healthcare spending. There are still deductibles, co-pays, co-insurance that you're responsible for paying, and that's why you should sign up for additional insurance to go with Medicare. Now, there are 2 broad categories of Medicare insurance. There's Medigap plans and Medicare Advantage plans. 53% of people have a Medicare Advantage plan in 2024, and 47% of people have some other coverage or either have no coverage with Medicare or have additional Medigap coverage, Medicare supplement coverage with Medicare. However, if you want to have a Medicare supplement plan, it's very, very important that you don't miss your enrollment period when your Medicare starts. This period runs for 6 months from the moment your Medicare Part B takes effect. So what's so important about this enrollment period? Well, it's because during this 6 months, insurance companies are not allowed to ask you medical questions. They're not allowed to have any underwriting process. They're not allowed to deny you coverage due to pre-existing conditions. And they're not even allowed to charge you higher premiums if you're unhealthy. This is so important because if you're trying to enroll in a Medigap plan outside of open enrollment period, then suddenly insurance companies can ask you a ton of Medicare-related questions, And if you have any condition, they can completely reject your application or charge you higher premiums that are more expensive. Outside of the Medigap open enrollment period, you have no federal protection in getting a Medicare supplement plan, which is why it's so important to enroll during this time. Now, if you're still working past 65, you can also delay getting a Medigap plan. This is because the Medigap open enrollment period is tied to the moment that you enroll in Medicare Part B. If you're delaying your Part B enrollment, you can also delay enrolling in Medigap, and when you eventually decide to get Part B, you'll have the same 6-month open enrollment period where you can get a Medigap plan without any medical underwriting. All right, so those are the 6 critical Medicare mistakes that people make when they're continuing to work past 65. But before I go, I want to throw in a quick checklist of things that you need to do once you decide it's time to retire and go into Medicare. So you can see here, 9 months before you retire, you want to stop contributing to your HSA if you have an HSA. Again, we recommend enrolling in Part A. If you want to continue contributing to your HSA, that's because you can get tax penalties if you do these two together. You'll want to stop contributing to your HSA months before you retire, because when you apply for Part A, they could backdate your coverage up to 6 months. And if you were still contributing to your HSA at that time, you can get tax penalties. Now, 6 months before retiring, you should really start digging into the differences between Medicare Advantage and Medicare Supplement plans. I do have some videos on the difference between these two. You can check those out on the channel, and we'll leave some links in the description below. But aside from studying the difference between these plans, you also want to shop for plans in your area, because the plans available to you will greatly depend on where you live. If you need help with this, we'd be super glad to help you out. You can call us to get an unbiased broker from our team to help you find the best plan in your area. We've helped over 60,000 people make a good choice about their Medicare or health insurance. Now, 3 months before you retire, this is when you need to enroll in Medicare Parts A and B, or just Part B if you already have Part A. You can do this online, but since you're already over 65 years old, you'll want to collect the CMS L564 form from your HR department and submit that together with the CMS 40B from the Social Security office. You can do this online, or you can mail it to your Social Security office or talk to them over the phone. Submitting these forms is a very important step to be sure that you prevent getting a penalty on your Medicare premiums. 3 months out is also the time when you need to enroll in your Part D plan. I say 3 months, but it'll depend on when you get your Medicare card in the mail. Once you receive your Medicare card, make sure you enroll in a Part D plan. Go and collect a notice of creditable prescription drug coverage. Once you enroll, your prescription drug plan may send you a letter saying that you have a penalty for not having drug coverage. You may need to get a notice of creditable prescription drug coverage from your employer and submit that to avoid a Part D penalty. Finally, this is also the time you'll enroll either in a Medicare Advantage plan or a Medicare Supplement plan. Keep in mind that if you are enrolling in a Medicare Advantage plan, in most cases, you cannot enroll in drug coverage separately. You have to take the drug coverage that comes with your Medicare Advantage plan. Now, 1 month before you retire, you want to make sure that everything is in place. You should already have your red, white, and blue Medicare card. You should have your Medicare Advantage or supplement card. You should have your prescription drug plan card if you're having separate prescription drug coverage. And also at this time, you should cancel any old policies that you have and make sure that you're not going to be paying double for insurance. That's about it for this video. I really hope this video helps guide you through the potential mistakes you could make when you decide to work past 65. Getting a permanent penalty is just painful. And it's our mission here at PlanFit to make sure that seniors never have to pay a cent more than what they need to for their healthcare coverage. That's why if you want to learn more about how to enroll in Medicare properly and all the potential penalties that you could get into, then check out our free Medicare workshop. In it, we go over everything you need to know about enrolling in Medicare, choosing the right plan, and how to save as much as possible. I'll leave a link in the description below so you can check it out. Other than that, thank you for watching, and I'll see you on the next one.